Hello, my name is Pope. I am an Indiana State University nursing student. My topic for today is about leadership concepts, skills, and decision making in nursing. Um, at the conclusion of this activity, students or viewers will be able to define what leadership is, responsibility of a head nurse, managerial duties or function, and how important effective communication is. But before I move on to the next slide, I would like the student or viewers to take the pretest quiz about leadership concept. 1. This is a joint trait of a leader, which is defined as his ability to possess honesty, responsibility, and maturity in the work area. A. Integrity. B. Personality. C. Intelligence. Or D. Flexibility. 2. You are head nurse in the pediatric department. Your roles in the planning process in the hospital include the following except 1. A. Act as link between high-level managers and non-managers. B. Directly responsible for the actual production of nursing services. C. Represent the organization. Or D. None of the above. 3. It is a managerial function that indicates leading the staff in the most applicable method. A. Planning. B. Directing. C. Organizing. And D. Controlling. 4. Which describes an informal leader? A. Competencies and continuing education. B. The leader of the team because of years of experience in the department. C. The leader of the team since gave the legitimate authority to act as one. Or D. The administration because of age and knowledge in the area of work. 5. Why is effective communication important in managing personnel? A. It fosters influence and power. B. It promotes independence and collaboration. C. It motivates personnel to do their jobs well. Or D. All of the above. As a new nursing professional development practitioner, the mastery of which skill is most important? A. Communicating effectively. B. Coordinating programs. C. Managing resources. Or D. Serving as facilitator. 7. Which of the following factors will influence the types of structure groups create? A. Member characteristics and preferences. B. The nature of the group's tasks. C. The interplay between important value. Or D. All of the above. 8. Group tension comes in two types. They are A. Internal and external. B. Interpersonal and intrapersonal. C. Primary and secondary. Or D. Group and environmental. 9. What can be done to reduce a group's primary tension? A. Establish clear lines of communication among members. B. Establish clear roles among members. C. Take the time for members to get acquainted. Or D. None of the above. 10. Which one of the following is not aim of nursing practice? A. Promote health. B. Prevent illness. C. Disease process. Or D. Restore health. Leadership concept, skills, and decision making in nursing. Providing the best possible care for patients. I work to provide the best care for patients and ensure that they are properly taken care of and their needs are met for faster recovery and smooth running of the hospital. Collaborating with healthcare teams. Teamwork is important, and I can work together with the staff on bettering the patient's condition and provision of high quality service. Communicating. Communication is a primary practice that should be applied in all areas. I am ready to apply my communication skill to work together with the staff and patients. Committing. I am committed to the work I do. I am open to providing top-notch services and applying my leadership skills to solve any problems or situations that I will come across in this line of work. Promoting a positive relationship with patient and staff. The presence of a good relationship among staff promotes teamwork, and the staff will be open to communicating some of the issues that need fixing. The patient needs peace of mind for faster recovery, and thus the presence of a good relationship with the patient is an added advantage to both the staff and the patient. Task-oriented. It is always advisable to have goals in the working area. I work through a system that I set goals and a list of tasks that I want to achieve within a specific time. These qualities enable the staff to work toward achieving tasks set either weekly, monthly, or yearly. The staff can also be divided into groups that are assigned tasks that have to be done with the group, thus improving their relationship and improving teamwork. The 5 steps of emergency management are prevention, mitigation, preparedness, response, and recovery. Prevention is action taken to avoid an incident. Mitigation is the process of preventing harm by assessing data of patient. Preparedness is ready to handle any challenges that surface. Response is the most suitable procedure when reacting to a situation. Recovery, these are activities that happen after stabilization efforts. Now let's answer some post-test questions. 1. This is a joint trait of a leader, which is defined as his ability to possess honesty, responsibility, and maturity in the workplace. A is 1. Integrity. You are head nurse in the pediatric department. Your roles in the planning process in the hospital include the following except 1. 2 is C. Represent the organization. 3. It is a managerial function that indicates leading the staff in the most applicable method. 3 is B. Directing. 4. Which describe an informal leader. 4 is B. The leader of the team because of years of experience in the department. 5. Why is effective communication important in managing personnel? 5 is D. All of the above. As a new nursing professional development practitioner, the mastery of which skill is most important? 6 is A. Communicating effectively. 7. Which of the following factors will influence the type of structure groups create? 7 is D. All of the above. 8. Group tension comes in 2 types. They are C. Primary and secondary. 9. What can be done to reduce a group's primary tension? 9 is C. Take the time for members to get acquainted. 10. Which one of the following is not aim of nursing practice? 10 is C. Disease process. And here are some references if you want to learn more about what leadership concept and skills and decision making in nursing are. And that concludes my activity.